Kenya has a population of about 47.6 million people, with a youthful population of about 9.7 million, aged between 15 to 24 years. This is the county of Mombasa at the Kenyan coast. It has a population of about 1.2 million people, a majority of whom are made up of the youth. Mombasa youth face numerous obstacles in accessing sexual and reproductive health information and services.
Some of the challenges that youths face, especially from Mombasa, and sexual reproductive health and family planning are: one, access to correct and accurate information from legible sources, and we also have the issue of commodity stockout, where a youth comes to the health facility hoping to maybe get an implant, but unfortunately it reaches the facility and the only options there are the ones maybe the youth doesn't want them.
There has been a bad rapport between the service provider and the clients, that is youth, and the main cause of it is the age difference in terms of the service provider and the youth. So a lot of youth tend to shy away from accessing services from old age service providers.
Challenges like you go for the services, you want family planning services, and then the providers, service providers, there will be like, hata wewe kwani unahitaji hizi, you don't need them. It's like this, the sexual reproductive health to women with a disability is not, it's not as important.
We never had a designated room where we could offer the youth-friendly services, neither did we have a youth-friendly center. In terms of SRH also, our youth, they were not accessing the services freely due to the lack of knowledge. There was a lot of stigma in such issues. So the uptake in terms of SRH for the youth, it was low.
In order to curb some of the challenges in relation to sexual reproductive health and family planning in Mombasa County, DSW Kenya commenced the implementation of Uadilifu Community Scorecard Initiative, which is aimed at improving governance and accountability in health matters by strengthening youth-led community actions.
We are the people who are responsible.
We have worked with young people for quite a long time, and every other time they keep complaining that they are not involved, you know, like in decision making. So we decided we would want a project that gives the young people meaningful engagement from the onset. Like we would want them to know the budget cycle and know when to engage, so that their issues are being captured, their recommendations are being adopted.
There has been coaching in budgetary allocation. We have been able to study and understand how the budget calendars runs in Kenya. There's been a lot of impact in terms of improving our knowledge in sexual reproductive health, including policies that involve sexual and reproductive health, commodity studies, and correct information on sexual and reproductive health.
They took us through our tool, which is the scorecard, whereby we use this scorecard to get the reviews on how the youths are accessing the services, whether they know the services.
The Community Scorecard is a social accountability exercise that brings together duty bearers and rights holders in a participatory process to rate public services and the performance of service providers using scores defined by the community. The objectives of the exercise were to assess the community members' satisfaction with the sexual reproductive health and family planning services provided in Mombasa County by the respective county government, to support communities to identify gaps in budget allocation, expenditure, and the quality of services provided, to generate a community scorecard on SRH-FP service provision for increased service demands and accountability on FP-SRH budget expenditure and provision of quality services in Mombasa County.
In social accountability, we were able to create a scorecard, community scorecard, where here we were looking into issues that surround the community in matters of sexual reproductive health, also in family planning, to be precise, and issues that needed to be prioritized.
The social accountability exercise was conducted in 2 phases, in Jomvu and Changamwe sub-counties.
We brought in these young people who were advocacy champions, and through their training, they were able to conduct a social accountability exercise.
And these were coming from the community through different avenues that we used, such as the focus group discussions, the key informant interviews that were done, and several issues were appearing that needed to be addressed within the community.
At Magongo, one of the issues that came up was the service providers were too old. Continuous and consistent stock out of commodities has been derailing the youth from seeking these sexual and reproductive health services.
When they requested for fabricated containers for provision of youth-friendly services, Chani has implemented that, and Mikindani. On top of that, specific service providers who are youthful and have been trained on youth-friendly methodology. So those are some of the successes that we have from the project.
One of the milestones we have been able to achieve through DSW support, they have been able to train several youth on the importance of seeking various services in the government offices.
Youths have now been engaged in forums, being sensitized about sexual reproductive health. They now know their rights, and they now know the existence of the youth-friendly status, whereby they can go there and ask for information.
There's a very great improvement. Currently, we can see an increase in the numbers of youth who are accessing SRH services.
Kuna coil, pigeni makofi.
We used to see around 200. Now we are seeing about 300 in a month.
If this information can be cascaded to other facilities, I think we can be able to offer services that are youth-friendly and which will be embraced by the youth themselves. As their slogan goes, nothing for them without them.